Mariah Carey. Oh my gosh, so many years ago singing Hero. Well, that is what the fans are calling her today after she revealed that she was actually diagnosed with bipolar disorder years ago. She tells People magazine she didn't tell other folks because A, she didn't want to believe it. And one of her fan pages now thanks her for, in part, raising awareness, saying she's an inspiration. A doctor tweeted, for example, breaking down barriers and stigmas. This is good. What is bipolar disorder, and what are the overall effects when somebody as big as that admits that they too struggle with health issues? Let's talk to our psychotherapist, Robi Ludwig, who is a mental health expert and has been joining us regularly on HLN through the years. Thank you for being up early, first of all.
Thank you for having me on this very important story.
Yeah, so she was diagnosed, I guess 2001. I'm trying to remember, when was the strange performance that she gave on TRL, on MTV, and people really remember this. Would that be an indication of how somebody who has bipolar disorder might display symptoms? You're up, you're down.
Okay. Well, I think it's really hard to diagnose somebody via a video, but certainly what we could have been seeing is manic type of behavior where you have increased energy, you might be highly sexualized, your judgment is poor, and in retrospect we can look back and say, hey, maybe these were signs of mania or hypomania, but to diagnose via a video, that's very challenging.
Oh no, I'm not asking you to do that. No,
I'm just saying I don't think anyone could do that. She's come out and acknowledged her diagnosis, so that's different. So yes, it could be seeing hypomanic behavior.
Okay, so that was in 2001 that that tape emerged, and it's 2001 she said that she was diagnosed. Now she mentioned in the article that it's bipolar 2 disorder.
Yes.
How's that different than bipolar 1?
Bipolar 2 is a less severe form of the mood disorder. So bipolar disorder is basically unpredictable changes in mood, and you have to have a manic or hypomanic experience in order to be diagnosed with bipolar disorder. Bipolar 2 means you have hypomania, which is a less severe form of up moods. It's less disruptive. You can still go to work. You probably feel good a lot of the time, but it is a less severe form of bipolar disorder.
You know, no matter what type of mental health issue we may be struggling with, for her, she says now that it's bipolar disorder. What does somebody this large admitting to it, what does it do for the rest of us? Or maybe should it do? What can we take away from that?
Well, it's so wonderful because it really destigmatizes a mental health issue. And so there's a lot of shame that still surrounds mental health diagnosis. And it really is unfortunate, and it interferes with too many people getting the treatment that they need and knowing that they can live a healthy and productive and successful life. Bipolar disorder is not that rare. So this is a wonderful thing that she's doing for her fans and just people in general.
You know, she had mentioned too that she kept it away from people, and that must be so lonely and isolating not to be able to share with someone who could also help you with empathy, or say, hey, are you taking meds, or have you gone to therapy or such? If you're someone who does know that you deal with different issues like that and you've been diagnosed, is there any way to go, you're a person, if I'm not ready to tell everybody that I'm dealing with this, how do I know if you're a person that I can trust? Is there some litmus test that you might tell some of your patients, hey, you know that you can share what you're struggling with a person who's in your family or who shows empathy?
I guess a person that you know to be trustworthy from your past. People who are educated about the disease are really good people to turn to as well. And also, if you have a therapist, work with that person on knowing who to share your story with. Every person who's diagnosed first has to come to terms with it themselves, and then they're in a better position to share that story with other people who support them and love them unconditionally and can share that commitment to them getting better on this journey.
So Mariah, the 5-time Grammy winner, says, I'm actually taking medication. It seems to be pretty good, not making me feel too tired or sluggish or anything like that. And she says it's all about finding the proper balance. I'm glad to hear that she seems to be doing well, and what a big step for her, but for other folks too, helping. Robi Ludwig, thank you.
Thank you for having me.
You bet.